Good afternoon, Vicenza and Derby military communities. This is Major General Roger Cloutier again, the USAG commander and the senior responsible officer for all of our U.S. Army forces in northern Italy. So as many of you know from last night's Facebook post, we announced our first positive case of a U.S. service member in Vicenza for COVID-19. So a soldier who lived in the barracks on Caserma, Italy was taken to the hospital after showing symptoms of COVID-19, and we immediately executed our COVID-19 battle drill. So we have an organization called Team Trace, and through detailed questioning, we identified 15 others, all soldiers who had regular contact with the soldier who was positive. They're all under quarantine right now and under observation by our medical professionals. We also have an organization called Team Clean. They descended on the locations where the soldier and those associated with him worked and lived, and they did detailed cleaning and disinfecting of all those areas. We've checked in with our soldier currently at San Bordello. He's in good spirits and he's doing well. But fighting this virus is an operation. COVID-19 is now inside of our wire, and that's a game changer for us as a community. We're fighting this virus as we would operate in combat, and that's with speed and violence of action upon contact. So now that it's inside our wire, there's going to be some definite changes coming. Our teams, Trace and Clean, and our 24/7 watch team did exactly what they were supposed to do and did exactly what we rehearsed. So that's critical. And everything that we're doing, again, is for your safety, the safety of our entire community, and to preserve our mission. Remember my 3 priorities. Number 1 priority, protect the force. Number 2 priority, stop the spread of the virus. And number 3 priority is to maintain mission readiness. So before we continue, though, I'm proud to have Colonel Basutti, the senior Italian officer for CTAF in Vicenza, sitting next to me. Well, this may be the first time that many of you are seeing Colonel Basutti. He and his team are always with us, working shoulder to shoulder with us day in and day out, and we could not accomplish our mission, Colonel Basutti, without you and your team's support. I personally want to say we're grateful to live here. We're grateful to be part of the community, and we're grateful that you are on our team and we're working this together side by side. So I know these are trying times for the world, but especially trying times for our community and for our Italian neighbors. So on behalf of the entire CTAF and Garrison Italy team, we stand in full solidarity with you, full solidarity with the citizens of Vicenza, and full solidarity with the citizens of Italy. And together, we're going to get through this. So we're fighting it. We're fighting this coronavirus together. We're standing side by side. And I just want to tell you publicly, thank you for your partnership, and thank you for working with us every single day. So thanks again for joining us, and I'll turn it over to you, please.
Thank you, sir. Buongiorno a tutti coloro che si sono collegati. Sono il colonnello Michele Biasiuti, Senior Italian Officer presso la base. Inizio ringraziando il signor generale Cloutier e il colonnello Vogel per l'opportunità di condividere questo videomessaggio. Quale rappresentante militare italiano più alto in grado, vorrei rivolgermi particolarmente ai miei connazionali per fornire, spero in maniera chiara, alcune mie considerazioni personali.
Good afternoon and welcome everyone. Thank you for joining in. I am Colonel Michele Biasutti, the Senior Italian Officer for the base here in Vicenza. First, I would like to thank General Cloutier and Colonel Vogel for the opportunity to share this video message. As the Senior Italian Representative Officer here, I would like to especially address my fellow citizens to clearly provide, I hope, some information along with some personal considerations.
Stiamo vivendo ormai da 3 settimane una situazione emergenziale senza precedenti. Da giorni siamo in una situazione dove abitudini e modi di vivere sono cambiati sensibilmente. Sin dall'inizio la nostra priorità, quella del comando USA e del comando italiano, è stata quella di assicurare l'adozione di tutte le misure e le precauzioni necessarie per proteggere la salute del personale militare, dei dipendenti civili, statunitensi e italiani, e delle famiglie che vivono e lavorano in città e nei dintorni.
For more than 3 weeks now, we have been living through an emergency that is unprecedented in our lifetime. For days, we have been adjusting to a new condition, where our habits, our way of life have been affected significantly. From the beginning, our priority as US and Italian military commands has been to ensure that all necessary measures and precautions are implemented to protect the health of military personnel, US and Italian civilian employees, and the families who live and work in Vicenza and the surrounding communities.
E questo è stato perseguito adottando tutte le direttive governative italiane. Quello che tutti hanno visto dentro e fuori la base è stata la progressiva chiusura di scuole, palestre, cinema, aree ricreative e molti degli esercizi commerciali. Dentro la base si sono aggiunte altre misure importanti, tese a migliorare l'efficacia dell'azione di contenimento del virus portata avanti dal comando statunitense.
And this was done by adopting all the directives of the Italian government. What everyone has seen on and off post has been the gradual closure of schools, gyms, cinemas and recreational areas, and most of the commercial activities. Progressively, other stricter measures have been added inside the base, all aimed at improving the effectiveness of the efforts put in place by the US command in order to control the further spread of the virus.
E cito alcuni esempi. Innanzitutto l'attivazione di una centrale operativa all'interno della base che ha monitorato la situazione sin dal mese di febbraio e che senza sosta ha migliorato procedure e il coordinamento tra le organizzazioni presenti nella base. Abbiamo poi assistito al potenziamento delle capacità mediche della clinica per renderla più efficace al bisogno. A tal proposito, ad inizio settimana ho incontrato personalmente i dirigenti dell'azienda sanitaria vicentina e vi riporto il loro riscontro positivo sulle misure finora adottate dal comando USA per prevenire e contenere il diffondersi del virus.
I can mention a few examples. First of all, the activation of an operations center that has been working around the clock since February to increase the procedures and the coordination among the organizations that are inside the base. Then the capacity of the clinic has been strengthened to make it more effective in case of necessity. In this regard, earlier this week, I personally met with the board of directors of the local agency ULS Otto Berica. I received their positive feedback on what the US military has done so far to cope with the current crisis.
Funziona tutto? No, non dobbiamo e non possiamo nascondercelo. C'è ancora da lavorare nel settore dei comportamenti individuali e nella comunicazione. Le direttive sono state emanate rapidamente, ma l'applicazione non si può realizzare semplicemente con un ordine o con l'invio di una lettera. È necessario spiegare, creare delle nuove condizioni di lavoro e mantenere un elevato livello di attenzione, preparandosi anche ad intervenire per correggere comportamenti non adeguati.
Is it all working? No, it is not. We have to be honest. There is still work to be done as far as individual behavior and communication. The degrees were issued fast, but their application does not happen simply with an order or by sending a letter. It is necessary to explain, create new conditions, remain very vigilant, and be ready to intervene in case of non-compliance.
Questo lavoro è a buon punto. Oggi la situazione dell'adattamento alle regole è sicuramente migliore di venerdì scorso. Possiamo però ancora perfezionarla con una decisa applicazione del protocollo del 14 marzo, soprattutto per quanto riguarda la gestione degli spazi di uso comune e delle misure che mirano a bloccare il contagio. Adattiamo le misure del protocollo alla nostra realtà e applichiamole tutti insieme.
We are well underway into this process. As for compliance to the Italian decree, we are doing better than we were last week, Friday. But we can do even better by enforcing the protocol dated March 14th, especially in regards to the management of the common areas and the measures aimed at stopping the contagions. All together, let's take the protocol, apply it and adjust our lives accordingly.
Ora servono due cose. Siamo come una compagnia di alpini nella tormenta. Primo, seguire la traccia lasciata da chi è in testa perché ci sta portando fuori dalla crisi. Secondo, aiutare tutti a rimanere su quella traccia, altrimenti rischiamo di perderci tutti. Questa comunità è fatta di americani e di italiani, di professionisti militari, di professionisti civili, di famiglie e di lavoratori. Abbiamo le carte in regola per raccogliere la sfida e vincerla, come dimostrano 70 anni di storia della base americana di Vicenza. Grazie. Thank you, sir.
We need to do two things now. We are like a company of alpini in a snow blizzard. First, we must follow the path of the person ahead of us, because that person is leading us out of the crisis. Secondly, help everyone to stay on track, or we will all get lost. This community is made up of Italians and Americans, civilian and military professionals, families and workforce. The US base in Vicenza has been around for 70 years, and we have what it takes to accept and defeat the challenge of this virus. Thank you all.
Biasuti, thank you very much. And I want to emphasize something that Colonel Biasuti said, and that's that we have to adapt our daily routines to prevent the spread of COVID-19. So we've posted personnel throughout the community to enforce and respect the Italian law. Remember, the Italians are our hosts here, and we must respect their law, and we have to enforce our standards. So we are going to rigorously enforce the Italian decree, and we're going to, my expectation as the commander here is that our soldiers, our family members, our DA civilians, and anybody that works on this installation or lives on our bases or lives in the community is going to adhere to the orders that have been put out. I routinely travel around the post, and I see personnel not in compliance with the decree. And my expectation is that we will comply and we will do the right thing. That this is a critical time for us now that we have our first positive case, and we have to tighten up our shot group and get after it. This is for the safety of the entire community. Okay, Dan, I'm going to turn it over to you.
Thanks, sir. I appreciate it. And thanks, Colonel Biasuti, for being here as well and your remarks. And I really like, your last 2 points of, follow the path and stay on track. And I think throughout today's town hall, you'll probably see that resonate in a lot of our messages. So thanks for that, Michele. So good afternoon, everyone, and thank you for joining us. It's great to be here again to share with you where we're at in the fight against the virus and provide some updates on the garrison and answer questions that you have. As you know, we are committed to providing our soldiers and their families mission essential services. We're doing that, but as many of you know, it's just in a different way. So everyone has been, in my opinion, extremely patient. I think our community, sir, has been extremely resilient. I'd ask for your continued resiliency and your continued patience because things will adjust, and things are going to get a little bit tougher for us before they get better. But I'm confident that we have the ability to defeat this enemy, this virus, and at the end we'll be a better community for it. As many of you know, with the exception of AFES, Commissary, and the PX, the majority of our base operations and services are either being delivered by appointment or telephonically. As we've talked about, I can't stress enough to respect the host nation decree and access the garrison base only when you need those essential services, and specifically PX, shopping, laundry, medical, etc. As many of you know, the housing office and services are operating telephonically. Both our housing and DPW customer services have staff available to answer calls. So just be patient when the telephone rings. The workers may be on another line helping another customer. So again, we have a lot of people in the community, folks in Bellagio. There is some reduction in our services, but if you have an emergency, we will still react. So no change there. If you are new to the community and looking for housing, and we have a few that have come in right in the beginning of the crisis, right now we will not be able to help you search for a home or negotiate leases until restrictions are lifted. However, your TQSA will continue if you're living in a hotel or in town, and always you can move to the Ederly Inn. And so, sir, I think, we look at the numbers. We have some in the Ederly Inn. We do have some that are out on the economy. We have space available, and so if you wish to relocate, that option is always there for you. As General Cloutier mentioned, be prepared for more restrictions as we combat the spread of COVID-19 with our host nation partners. If you are not going to the grocery store, shopping, or leaving your house for something essential, I can't stress it enough, you need to stay at home. If you leave your house, you must have that self-declaration form with you. If you're sitting there thinking, what is the self-declaration form? Please contact your sponsor immediately, have a discussion with him or her, or contact your chain of command. Okay, because you have to have that self-declaration form when you're traveling, whether it's in your vehicle, on your bike, or walking from point A to point B. As one of our local mayors said it so eloquently recently, the virus has no legs, except for the ones that you give it. So the best prevention against any virus is staying at home. And so with that, that's all I have. I think we'll be able to get to questions. Unless, Joe, do you have any opening comments?
Yes, sir. I'd like to say a few things. Thank you. And good afternoon, everyone. I want to reassure you that your medical team is still here. We're still taking care of the community. We join everyone else, as everyone has been emphasizing here, in practicing social distancing in order to decrease the spread of the virus. Your medical professionals from USAG, 173rd, the dental activity, the public health activity, and the clinic, we're all working together to make sure that the community is getting the necessary medical care that it needs during this pandemic. We remain committed to conserving the fighting strength. Maintaining readiness and providing acute care to you and your family remains one of my priorities. Social distancing and good hand hygiene are our best weapons to fight this together. So I know it's not always easy, so thank you for what you do in making sure that you have minimal contact with others in order to minimize the spread of this disease. We do continue to work closely with the host nation hospital system, and they're committed to taking care of our community throughout this crisis. Specifically with San Bortolo, we continue to communicate with their OB department. They are continuing to provide care, and that's not going to change at this point. What does change is they are practicing social distancing also. So they are going to change the amount of times that you have to come in to minimize your exposure to other people. They will also minimize the amount of visitors that you can have to minimize the exposure to other people. All of the things that they are doing, while they can be inconvenient, and I know it's a stressful time, but everything that they do is to protect you and protect your family. Now, I know I've said it many times before, but it bears repeating. If you're sick, please stay home. For lifeline eyesight emergency care, call 118. If you have a need for a less urgent appointment, please give us a call and we'll set up an appointment for you to come and see one of our providers. Remember to wash your hands. Remember to limit your movements and contacts with other people. When you're out in public, please encourage others to practice social distancing also, and call your medical team if you have any questions. Lastly, if you have chronic medical conditions or you're over the age of 60, please, whenever possible, please stay home. That's what I have, sir.
Thanks, Joe. Appreciate it. Okay, I think we're ready to take some questions.
Okay, first question. If the situation gets worse, are U.S. family members going to be sent back to the United States?
Okay, so conditions can always change. However, right now, the Department of Defense is concerned about minimizing any travel as it places travelers at additional risk. So our focus is to fight the virus. We have a very good, in my opinion, approach towards stopping the spread of the virus, and we're going to stay on that track. So right now, that's where we're at, and we'll continue to fight.
And let me just jump in there. So again, we have nightly meetings with headquarters Department of the Army. Stop move has been put into effect for 60 days. The plan right now is for families not to go back to the United States. The United States, CONUS is conducting its own preparations there. They have coronavirus in the United States. And so each state and locality is putting their plans into operation. If there's, an emergency or a specific situation that would call for a family to return to the United States, we review that collectively, each and every individual case on a case-by-case basis, and we make those determinations. But right now, there's no plan to move the families back.
Okay, second question. If we have a positive case and we know that the virus can be dormant for 10 to 14 days, why aren't we shutting down?
So, well, a lot of the services on base has been shut down. I mean, a significant portion has closed. And as we alluded to in the beginning, there will be some more restrictions and measures that we take as we continue to assess the risk and continue to combat the spread of this virus. As many of you know, we're already at minimum manning and essential manning within our installations. And then I think it's important for everyone to recognize that at both here and Darby, there are service members that live here. So there are critical functions within the community that have to run. I've seen a couple of comments on Facebook that say shut the base down. But what I want to convey to everyone is we can't just shut the base down. There's certain services that have to run. Fire and emergency services, our medical services, our boiler room, our host nation professionals that work in the boiler room, our electricians, and then the thousands of service members that reside in the barracks that have to be fed, taken care of, and cared for. And then we have a pretty significant team that's here fighting this virus and coordinating with outside agencies and higher levels of command to ensure that our community is taken care of.
Yeah, so again, if I could just, pile on that. So we have gone through every service that's provided by the garrison and eliminated or closed those non-essential services. But the bottom line is we have several thousand soldiers and family members that live in our community that have to eat. The commissary has to stay open so you can come get groceries. You need to be able to buy essentials at the PX. Like Dan said, the clinic has to stay open so we can take care of you guys. So we're looking at every single service. If it is not mission essential and not critical to the functioning of the community, then we're going to shut it down.
Okay, next question. What are we doing differently now that we have our first positive COVID case?
So from the outset, we've had an operational approach to combat this virus. And we were very deliberate in the beginning of laying out kind of our phased approach as the virus continued to grow within the community. And we are staying the course in that regard in terms of our mission to combat the spread. But as conditions change and as things change, such as a positive case, and as General Cloutier mentioned, inside of our wire, we're going to take some more aggressive measures to prevent continued spread. So you will see some additional restrictions. Some of the things we are looking at is curfews or limiting the movement at night, because really you shouldn't be outside your house unless you have to go to an essential service, and most of your essential services are closed in the later evenings. We have eliminated any type of physical training running off base. So that is another adjustment. And then we're looking at a series of a couple other actions to put in place that are more restrictive in nature, as well as continue to follow and abide by our host nation decrees.
And so we got to make sure that we are tied in with the Italian government, and we are making sure that we respect their law, and we're all doing all the right things. But the good news is we had some very detailed plans in place. So we were doing everything we could to prevent the first positive case, but once the first positive case was identified, like we said, we had plans in place and we executed our battle drill to respond to that first case. And those soldiers that were close contacts are in quarantine and being monitored by medical professionals. So the plan is working, but now we have to really, all of us, look at ourselves and make sure that we as individuals are contributing to this fight. We all have a responsibility to stop the spread, and as the mayor said, the virus doesn't have legs. We're the way that it gets around. So we have to make sure as individuals we are following and respecting Italian law, and we are disciplined, and we're executing the orders that are given by our chain of command. So this virus cannot spread any further.
Next question. Why is the PX not allowing us to buy school supplies when we are all homeschooling?
Well, so that's a great question, and actually that question was addressed specifically to me, sir, and everyone by my wife probably a couple of days ago. But what I would tell you is the PX is allowing that type of sale to occur. So what I think happened, is that there was an advertisement or a flyer that either provided the perception that you couldn't buy it, or at the time they may have been in a different spot in the store. As soon as I heard that, I went to the store the next day. I talked to our AP's manager, and I can assure you that you can buy supplies for homeschooling. Okay, so really what's closed down at our PX is in general your merchandise, that is clothing, not to include baby clothing, but your Mountain Hardware, your 511, your running shoes, the jewelry section. Those areas are just taped off. So what I would suggest to you, when you got a critical shopping need, and it's an item that is typically carried at the PX, you go to the PX. The areas that are off limits where we're not selling that merchandise is marked, and really everything on the entire left side of the PX is available because they're critical functions that supplement or enhance what you can find at the commissary.
And I'm sorry to keep jumping in, but the reason we're doing that is because now we have to do social distancing. There can only be a certain amount of people in the PX at a time. And so what we're trying to do is get people in to purchase those essential items that they need, and then have them move out so other people can get in. When we first started, there were long lines and people are spaced out, a meter apart, everyone trying to do the right thing. And what we're trying to do is get people in, purchase your items, and get out so everybody can get what they need.
Okay, next question. For those unable to collect mail, will their items be held at the post office until the travel restrictions are lifted?
So the short answer is yes, they will. Monica's in here. If I need you, or if I say something wrong, please jump in. But yes, we will. Hold your mail. What I would ask you to do is just be considered or think through, I shouldn't say be considered, think through if you have a lot of purchases occurring online. Because we do, as you know, we have a small post office. We have limited storage. So we do have quite a few boxes piling up. You can travel here to get your mail. There is the mail service, in the host nation decree. It may not be listed specifically as one of those essentials, but specifically post offices are identified as a functioning element or service within Italy, and so therefore you can come to the base to check your mail. So there might have been some confusion there. However, if you're concerned and you don't wish to travel, we will not return your mail. And then there are ways to contact your post office and put a hold mail so that at least they're notified of what your intentions are.
All right, next question. With stateside colleges and universities shutting down, has there been any thoughts on how we are getting our college kids, our dependent college kids, back home?
Right, so I'll take that one, Dan.
Yes, sir.
This has been a big topic of discussion throughout the Department of the Army. And so, dependent student travel is still authorized for students who are in the States, whose university have shut down, who need to come back. So that process still exists. The problem is the availability of commercial flights. So there aren't a lot of them coming into Italy or Europe, and so that's problematic. We are working with the Department of the Army to look at what exceptions we can get to get these students that are stranded basically at their university, if the university is shut down, to get on Patriot Express type aircraft or even military aircraft. But that is working right now. We don't have a definitive answer. I'm in the same boat as you guys. My son is at college and his university is shutting down and going online, and we are wrestling with the same thing. But if there are commercial flights available, you can still use, and I forget the exact term, dependent student travel, I think is what it's called, and those tickets are reimbursed that. But you can ask your chain of command for the specifics.
Okay, next question. Can anyone come to base and use the gym and the gym items that are left out on the track?
So if you hadn't been here today, those gym items is no longer there. So last night made the decision to remove them, and so probably the next follow-on question is why. And so just a couple of things. The bottom line is over the course of the last, I guess it's been up probably about 12 or 15 days or so. The bottom line is we've had several violations out there in terms of people traveling to post just to work out. So kind of back to the original question is you shouldn't be traveling here just to work out. That's not a mission critical need or one of the essential requirements, right? But we did have people doing that. We also had folks that started to gather around not maintaining their social distancing and their 1 meter spacing. And you know, even yesterday we had children climbing around it, even with signs. So there's a safety and health, just in general, safety concern out there. And then even one day we had a dog running around there, you know, something like that. So the bottom line is I assessed that we had some vulnerabilities, and also taking a hard look at some of the host nation decrees and what the Italian partners and what is expected of us, and so therefore I removed that gym equipment, so there is no longer any gym equipment out on that field.
And Dan, I got to pile on. So in addition now, with this positive COVID-19 case inside our wire, groups of soldiers or family members congregating together to conduct PT creates a vulnerability. And remember, my number one priority is protect the force and to stop the spread of the virus. So that was just a vulnerability that had to be closed.
Okay, next question. Is there a way we can give pregnant people front of the line privileges at the post office and other places where lines gather?
So there is, I know there's been several areas where we got some lines. You know, I know outside the commissary today, we started to see a line out there, sir, and you know, Sergeant Major fortunately was there, got involved, and got folks moving in. Similar to the post office, you do start to see some lines at some of the peak times, and especially you know, really right prior to opening. So what I would suggest is if you have a medical need or something where you feel that you need to get to the front just due to a medical condition or, you know, pregnancy, we do have service members that are out there that are primarily there for their team, what we call them Team Overwatch. They got their reflective belt, but they are empowered to make on-the-spot corrections. They're there to enforce social distancing. Okay, so that's what those soldiers are there to do, and to help monitor the lines. But if you have a concern and your medical condition requires, I would ask you to just convey to those soldiers and just ask them if you can move them to the front of the line. Now, that's a great question. That's something that we haven't necessarily taken into consideration yet. So I need to go back to those soldiers and let them know that they're empowered to do that. And so that's probably the best way we can do it to accommodate that part of our force.
Okay, now moving on to some medical questions. First one is, what is the care plan for U.S. personnel as San Bortolo reaches capacity? Does that apply to civilians? And what if my kid needs stitches or something in the middle of the night? How can we protect them from exposure if we need urgent care?
Okay, I think, well, yeah, over to you, Joe.
I'll take that one, sir. Thank you. So fortunately right now there is no indication that San Bortolo is going to reach capacity. We're keeping a close eye on the situation, but there are other host nation facilities that are in the area that they can transport you to if that's necessary for your care.
Okay, another medical question. Why can't everyone on the base be tested for COVID-19?
So that's a great question. We're testing everybody that meets the requirement for testing based on who the World Health Organization, or CDC, and that's the Center for Disease Control and Prevention, but based on their guidelines. So in order to make sure that we are testing everybody that we can, we have set up the acute respiratory clinic, which we're running in the mornings. Now, in order to make sure that we're following social distancing, we are doing that by appointment, so we don't have a bunch of people stacking up and waiting together and potentially spreading illness.
Okay? And another one that just came in, can nurses or other professionals volunteer to help?
Let me jump on. So one of the things we just sent out in a Frago is to get an understanding of all of our licensed professionals, in particular in the medical arena, that are out there in our community. Sir, I got to follow up on that Frago. I know it went out. There was a suspense to get in. So we're asking for that data because we want to know who's out there, what the skill sets and the capabilities they have, and how we can reach them. So if there is a need, that we can call.
Yeah, I think it's a great point. So right now, and Joe, I don't want to speak on behalf of the clinic, but right now we have capacity. We don't require volunteers other than the normal volunteers that are coming in. But we want to identify who is a licensed or credentialed medical provider, whether it's a nurse or a physician assistant or a doctor even, or whatever is out there. So we have a roster. In the event that we need help, we're going to ask you to come in and give us a hand.
Yes, sir. So please go to the Red Cross and let them know what your skills are, what you have a background in, so that we have that list. In the event that we need your help, I thank you for signing up and letting us know that you're out there and ready to assist when needed.
Okay. Will you enforce temperature checks at the gates and before entering stores on post?
So right now, there is no plan to conduct temperature checks at the ACPs, our access control points, or at our stores. What I would kind of go back to is our operational approach and following some of the strict precautionary measures, such as staying at home, social distancing, 1 meter separation, washing your hands, etc. I would also point out the recent host nation protocols, which is a great list. It covers many of the same things I just spoke about. But one of the things that our host nation partners are asking of you, and that I'm asking of you, and the entire community is asking of you and expects of you, is to not travel when you have a temperature, to not travel when you are feeling sick. We have to take it on as our own, civic duty to ensure that we are not running a fever. So we need to do that. We need to, start taking responsibility for our own actions. And then we, as a garrison, are applying several measures and resources to reinforce that and ensure that to ensure the safety of our community.
Okay, local national workers at the Donnie facility in commissary have complained that they do not have protective gear. How do you plan on supplying them with that PPE?
So we've met with our union representatives. We've met with several of our host nation professionals, as well as the managers of our stores, where the concern is. And the personal protective equipment arrived on the ground approximately 48 hours ago to provide to those our valuable employees, and it's being distributed today. In fact, myself and Colonel Piazzuti, we spoke about it. Him and I, he called me about it this morning. We had a good conversation about it, and so it's getting into their hands. So we are providing that for our host nation employees.
Okay, a school question. What is the plan for graduating high school seniors?
Mr. Rudy's here.
Yes, sir.
Fabulous DOD representative, superintendent. Would you mind?
Happy to answer that one. Good afternoon, Vicenza parents. The question regarding graduation, right now we are planning to have a graduation on time. That is the foundation of our digital learning plan, to make sure that our students are able to graduate on time. The venue of that, the delivery of that, remains to be decided based upon what any of the decrees might come out related to gathering sizes as we move closer. We do have a venue for that, and so we are prepared to deliver graduation if the conditions allow that, and we are working on some virtual options should the conditions make that necessary.
Can I just jump in and say one thing about that? So from the very beginning, again, I say this every town hall, but I want to thank DOD and the hard work that you guys are doing. We have over 1,100 students that are doing school online. And from the very beginning, the intent was every single day will count, And come graduation time, our students will graduate because we know seniors are going to have to go to college and they're going to have to move on with their lives. So that's the plan. Again, we don't know how long this is going to last. If it's all over and we come out of the other end and we can have a graduation downtown like we've done historically, then we will absolutely do that. If the conditions haven't changed, then we just have to be creative, but our students will graduate. That's the plan.
Okay, a couple more medical questions. Number one is, if there's no treatment for COVID-19, what do they do in the hospital? And I know there's been a lot of talk about respirators, ventilators. So can you answer that, please?
Sure. I can take it too.
Absolutely.
So yeah, that's a great question. With a lot of viral illnesses like COVID-19, there is no specific treatment to attack the virus itself. But when the virus has an impact on the body, that's what we focus on, and making sure that we are maintaining the body's ability to regulate itself while it's fighting the illness. So they'll do a variety of different things based on each case. So they may be giving antibiotics. If you have a superinfection of a bacterial origin, they may give IV fluids to support hydration. And in bad cases, sometimes people need assistance with being able to breathe, so that's where ventilators come into play.
Okay, another medical question is, will we have drive-up services for testing as we've seen in Germany and in other places like Korea?
All right, so that is definitely something that we are looking at as a possibility. Fortunately, at this point in time, the amount of people that we need to test is not at that level. So we are able to provide a better service at this point. So we can actually get in and do a very thorough evaluation. Like I was saying earlier, we're testing everybody that meets the criteria of the World Health Organization or the Center for Disease Control on who needs to be tested, just like they are for all those drive-in services. They use the same criteria to determine who they're actually testing.
Okay, what have been the disciplinary measures taken for personnel who are not in compliance with the current Italian decrees?
Okay, well, so first of all, I think you have on-the-spot corrections. One of the things that we're doing is with our team Overwatch and empowering our service members to do that. I know that the leadership, the military leadership with on base have been empowered, as always. They're senior non-commissioned officers, the ones that are entrusted to enforce good order and discipline, to do just that. So with on-the-spot corrections comes NCO enforcement, which opens up a whole host of typical preventative or reinforcing measures to ensure standards and discipline are met.
Okay. How can workers here on Darby and in Caserne Meadow and Deldin get protective equipment if they don't have it?
Can you just rephrase or restate the first part of the question?
So how can workers here, and I presume this is local, national, and or military workers, those who are not minimal manning and have to, or those who have to come to work, how can they get a hold of some PPE?
So again, similar to what I just spoke about in terms of our APHES, commissary or DECA employees, and we specifically focus on those employees that are involved in the customer service oriented jobs. So the ones that are routinely making, have contact or come in close contact with several individuals throughout the course of the day. So that equipment has already been provided and or in the process of being provided as of this morning. In addition, you should have seen, if you've been into the Express, we've purchased these drop down, I'll call them shades. They're clear, but they separate the person in line with the person behind the cash register. So that's all occurring. We've reinforced a lot of sanitary supplies, hand washing stations, but also wipes at the areas where you're punching the keypad. If you run the credit card, you should see the standard practice of being handed a wipe once you punch in your credit card or hit yes or no on a receipt for you to wipe down your machine in your handprint, so to speak. Wipe your hand, you put it in the trash, and you gel out on the way.
Okay, so questions in regards to the positive COVID service member from yesterday. Number one is, what exactly were the symptoms and how long were the symptoms present, and did he previously seek testing or care?
So I think it's important to talk about the process, and we've talked about this a little bit in previous town halls because every situation is different. Everybody's flu-like symptoms are probably a little bit different, etc. So when a service member, family member, member of our community has flu-like symptoms, the first step is to contact your provider, and we encourage you to use the 118 for emergencies, and or contact your clinic. You'll then be met via telephone with one of our providers. They'll talk through what's occurring, and then from there you'll move forward to conduct the test, depending on the protocols and depending on what you're doing. Once you're tested and we're pending results, there are different ways we go depending on if you're a member in the barracks or if you live at home. So again, there's different scenarios. But once the test comes back, and in this case it came back as positive, then we immediately move into conducting our social trace or social contact history, which is what General Cloutier kind of mentioned when he mentioned team trace. We have a huge element that's been trained on this by our fantastic public health nurse who specializes specifically in contact tracing. And so basically the individual steps through a series of a written report, as well as then we have follow-on questioning. From there, it then kind of spans out. We look at who that individual's close contacts were, and then those close contacts are then engaged with and they're personally spoken with by our team. And from there, we determine who is a close contact and then who needs to go into quarantine, which is exactly what happened last night. We do not wait. We do not delay. Upon notification, this element immediately begins execution. And last night, we were putting people in the ROM facility at around 2,300, 2,300 to 2,400 hours. So that's the process. Every case will be different, and even when we have patients under investigation, it's always different. There's always a little bit of a ringer. But what I want to emphasize is we have a process that's been vetted by our public health professionals, our medical team, and all of our leadership, and that's what we execute, and that's what we work on.
And I just want to say, we should all be really proud of these soldiers and these teams that are doing this. We're in week 4 of this operation, and we have been preparing and rehearsing and training for what we hoped would not occur, but it did occur late last night, and as soon as I got the phone call and Colonel Bowe got the phone call, they sprang into action and they executed exactly like they were supposed to. So by rehearsing and training and getting ready for this eventuality, we think we can minimize any impact of a positive COVID-19.
Okay, well, down to the last 2 questions. Should we be wearing masks when we go to the grocery store and or on post? We see a lot of Italians wearing them, so they're being told that's what they should be doing. If we should be wearing them, as opposed to making them available to us.
All right, sir, I'll take that one. I'm going to fall back on guidance from the Center for Disease Control and Prevention and the World Health Organization. And what they recommend for wearing masks is that you should wear a mask if you're sick. And that way it prevents other people from getting sick. You're gonna keep the cough and the sneeze and the droplets that come from that in when you've got that mask. Other times that you should wear a mask is when you're gonna take care of somebody that's sick. So if you are taking care of somebody that's sick and they can't wear a mask, that's when you need to protect yourself. If you're sick, you shouldn't be going out. You should be staying home and not going out there spreading disease. So you wouldn't need a mask if you're not out spreading disease. Other than that, one of my concerns is that people will frequently not wear them properly. So they're not trained to take them on, put them on, or take them off. And frequently you'll find people messing with their face more. So it can actually potentially be a source of infection and increase your risk for infection. So at this point in time, I would not recommend wearing a mask if you're not sick and you're not taking care of somebody that is sick.
Okay, and a question, as you could probably imagine, we've always had a lot of questions on these, and that's exercise. And can you tell us the rules for exercising outside?
So right now, and what we're doing is, so for those that reside on base, no physical activity outside of base. Physical training is a critical part to our mission readiness. And I know that there's been strict guidance provided to our service members in terms of maintaining their social distancing and operating at a smaller unit level in the conduct of PT. For those that are looking to exercise on their own, in your private home, what I would suggest to you is you work out in your garage, if you have one. Many of you probably don't, but then you have your outdoor backyard. I would anticipate further restrictions. If you remember early on, there was discussion about that you can go for a jog. What we're seeing now is that is being discouraged. All right, so I would encourage you to stay in the confines of your immediate domicile or residence. Okay, so you're going to have to do kind of those high intensity sprint type workouts and avoid the marathon training, unfortunately, right now until we get through this.
And a couple things that we've seen. So I don't think the decree has changed and has banned outdoor exercise. Is that correct? It has.
Sir, there's some additional local regulations being put in place on top that are more restrictive than the national regulations.
Have they been published yet or no? Or
In some of our communities, yes, sir, they have.
We started sharing today, sir.
Okay, all right. So the situation is dynamic. It's changing. I think what I would tell you, at 6:15 this morning, I had my app open and I was in my living room and I was doing my PT. We have to be creative, and so as conditions change and there are more positive cases, and again, we think we're still in the ascendant phase of this curve. We have to be creative. What we can't do is not respect Italian law. What we can't do is congregate in groups. What we can't do is run in formation. So we have to exercise individually, or if you were exercising as part of a unit, as part of organized physical training in the morning, then that unit chain of command needs to make sure that we are adhering to social distancing and doing everything right. But what I would tell you is we all need to keep our eyes and ears open, because I think there's some changes coming that we're all going to have to adhere to.
Yes, sir. That I think that almost exhausts the questions. I think you've addressed most of the questions that have come in. A lot of them are repeat questions. So with that, I'll turn it over to you, to Colonel Vogel, and then to General Coulier.
Well, so first, I appreciate everyone in the community joining us today. I appreciate the questions and the continued dialogue as we continue to fight this virus. I applaud our community's resiliency. I think I've mentioned it several times, and I've mentioned it to some of our senior leaders of how resilient our community is. I truly believe that we, at the end of this fight, will be an even stronger community. Continue to engage with the garrison. Continue to follow us on Facebook and use the various platforms. If you have questions, concerns, in order for us to be alerted to them and get them answered or get them fixed. So thank you for everyone. I appreciate what our entire workforce does and our entire community during this difficult time. But rest assured, I think, as Colonel Biazuti pointed out, we follow the path and we stay on track, we'll defeat this virus. Sir.
Thanks so much for being here. We really appreciate you sitting with us today. And look, I want to tell you, I'm very proud of our community. We have done what we need to do to get ahead of this thing. We are doing a great job. We just need to continue to refine our posture and make sure that we are staying ahead of this. But I'm very, very proud of our community and proud of all of our soldiers, our family members, our civilians, and our Italian partners that are working with us every single day. The senior leadership of the Army recognizes the hard work that Vicenza and the Darby communities have done to posture ourselves to get through this thing. But we don't know how long it's going to last. We have to stay the course. We have to stay steady. We have to personally discipline ourselves, myself included, right? We all have to be personally responsible for our actions and our activities, and we have to stay the course until this thing is over. I am not going to lift up on the pressure until we come out the other side. I'm going to maintain the pressure to make sure that we keep our communities safe. Remember my priorities. Protect the force, stop the spread of the virus, and maintain readiness. And Colonel Biasuti, I want to assure you that the Vicenza and Darby communities stand shoulder to shoulder with you throughout this thing, and we're going to work together and we're going to get through this thing. So I appreciate everybody's patience and all that you are doing to keep yourselves and our community safe, and we'll see you again next week.
Okay, we're good.